A rhinoplasty or a nose reshape operation is a surgical procedure which is used to reshape an abnormal looking nose, either as a result of development or as a result of previous trauma. The best candidates for a rhinoplasty are those people who have a visible, noticeable deformity which they're unhappy about, and who will accept an improvement rather than perfection. The people who should avoid a rhinoplasty are those people who have unrealistic expectations, who have thickened skin over their nose, who won't otherwise get a good result, or people who are medically unfit. It's not necessary to see your GP. You can go direct to any surgeon by recommendation. That's perfectly in order. When you arrive, you're greeted by our receptionist who will give you a medical questionnaire to fill in. Once you've completed the medical questionnaire, you'll see the surgeon who will go through your medical history carefully to exclude any contraindications to surgery. He will then examine your nose and determine what you're unhappy with. And then once he's happy that he can help you, he'll discuss everything in great detail, including all the post-operative complications. And then you should go away and think about it. At the same time, you're given a lot of reading matter to supplement your consultation so that no stone is left unturned before you make a final informed decision. The best way to prepare is to do a lot of background research before even your consultation. The consultation is the most important part of the procedure. There's a lot of information on the internet, there are a lot of books written about the subject. Once you have gained sufficient knowledge, then choose your surgeon carefully. Once you've seen the surgeon, make sure that you're happy with him, and if you're not happy with him, then seek a second opinion. It is important that you communicate well with your surgeon, that you trust your surgeon. Make sure that he does this operation on a frequent basis. Make sure he's done a lot of these procedures. Insist on seeing his portfolio and see what sort of results he will get. Try and get him to show you a nose that looks vaguely like yours, although it's not always possible to get anything like that, to give you a rough idea of what it's going to look like afterwards. And when you're happy with everything, then go away, think about it before you make a final decision. Every single nose is unique. The surgeon must resculpt every nose according to the situation at hand, and bear in mind what the patient has requested at preoperative consultation. Essentially, there are two basic techniques that are in use today: the closed rhinoplasty and the open rhinoplasty. In the closed rhinoplasty, all incisions are made inside the nostrils. There's no visible external scarring. With the open rhinoplasty, an inverted V incision is made in the columella, which is the part of the nose that extends from the tip to the upper lip. And it's through that incision the nose can be opened up and the operation performed under direct vision. The usual course of events is that the patients are put to sleep, so it's much safer to operate with the patient asleep. Once the patient is asleep and the incisions are made, one can get under the skin and operate on the underlying bony cartilaginous framework of the nose so that all the cartilages can be changed or altered. The bony or any bony abnormalities can be dealt with. One has to then, in most reduction rhinoplasties, have to break the nasal bones in order to attain the final finesse. So all this is done at the time of the operation, and at the end a splint or a dressing is put on the nose, which is left in situ for a week to 10 days whilst everything is healing. This splint is taped to the forehead and to the cheeks, and the patient is usually kept in overnight in hospital. It's not usually a painful procedure. The operation is usually performed under general anaesthetic, and most surgeons will inject local anaesthetic into the actual tissues of the nose so that when the patient wakes up, the nose is still numb. In the event that there will be some discomfort afterwards, the patients are given the appropriate medication to deal with any discomfort or pain afterwards, but it's not noted to be a painful procedure. After the operation, there will invariably be some bruising and swelling around the eyes, which will last for about a week to 10 days until the plaster comes off. You can expect a bit of bleeding, minor bleeding in the first 24-48 hours, which is inevitable. It's not usually serious. There may be some numbness of the tip and the upper lip in some cases, which will come back to normal fairly quickly. Other than that, it's not a painful procedure or causing much distress or discomfort, and recovery is usually within about a week to 10 days. Realistically, the downtime for this procedure will depend on the type of work that you do. A sedentary person who works in an office behind a desk can expect to be away for as long as the plaster is on, which is usually about a week to 10 days. Obviously, people in a much more physical job will require a bit longer, usually 2 to 3 weeks maximum. It should be enough to see them through. In all the incisions in a rhinoplasty, the only times that, the only situation where you will see any scarring is with the open technique, and that's usually an inverted V in the columella, as previously mentioned. Usually this will heal quite well without an obvious scar, although occasionally scars can misbehave and heal unfavourably, and that can require sort of adjustment procedures at a later date. With the closed technique, all the incisions are inside the nose. There's no visible scarring whatsoever. For an open rhinoplasty, the incision is made in the columella, which is the part between the tip and the upper lip. It's a small inverted V incision, which usually heals quite well. After the operation, patients are advised to take it easy for a day or two and sleep upright, avoid sneezing through the nose, try and sneeze through the mouth wherever possible in order to avoid a hemorrhage afterwards. Shaving is very difficult, so a dry electric razor is advised. Hair washing is not really advised if you can avoid it for a week because of the tape on the forehead. Although some people do it, it's not usually advised. And other than that, it's recommended to take all your post-operative medications, which are usually prescribed when you leave hospital. In expert hands, the risks are very few and far between. Infection sometimes does occur, but this is readily treated with appropriate medication. There are risks involved in terms of usually related to the healing process. If too much scar tissue is laid down under the skin in the long term, that can lead to abnormalities or small deformities, which can be adjusted at a later date. If the patients have been counselled correctly and the operation is performed expertly by someone who does this procedure, who's trained well in this procedure and does it very frequently, the results are usually excellent, and you very rarely get problems from people saying that they're unhappy with their result, although an unfavourable result can sometimes occur. Results of a rhinoplasty will usually or should lead to a more aesthetically pleasing shape and profile, which is the purpose of the exercise. So it should be a smaller, usually thinner nose, straight nose, that a hump is taken away, the tip is usually narrowed, and overall all the angles are correct, and the whole profile should be much more aesthetically pleasing. It is far more favourable just to do the one procedure, and that should last many years. Obviously a nose will change in shape in the fullness of time. As one gets older, the skin will become thicker and the shape will slightly change. But short of severe trauma to the nose, the shape should remain for the rest of one's life. I usually tend to do a rhinoplasty on its own. I mean, there are surgeons who will do blepharoplasty in the face of it at the same time, but I usually think it's a bit too much to do in one go. It's usually best to do one procedure, wait for it to settle in before attempting another procedure. A fully qualified cosmetic surgeon is the best person to do this. Someone who does this operation on a regular basis, someone who's done them over many years. I personally believe it takes 10 years to become proficient at doing this operation, to get consistently good results. Although the basic steps may be fairly straightforward, a good rhinoplasty surgeon stands out because he will get consistently good results, and that's what you're aiming for. One can expect to pay anything between £3,500 to £5,500, depending on the complexity of the procedure or the location where it's done. From clinic to clinic, it does vary.